Hi, welcome back to NurseEdScholar. Today I'm moving on to episode 7 of the Stop Fearing Dosage Calculation series. And today we're going to talk about heparin, okay? When you think about heparin, think about it like this. You know that your patient has a clot, right? And the provider, they order 5,000 units of heparin. And you go in and you figure out the right dose, right? And then everything looks pretty good. But then, you go in and you assess your patient because you should ask questions prior to. And the patient says, when I was brushing my teeth this morning, my gums started bleeding. Okay. And so now, you have your insulin, and now the patient gives you this new news. Now, do you still give the insulin, right? And most nursing students, are focused. Okay, I have the insulin, I have the order, I'm going to give it. Not the insulin, Lord. You have the heparin, you have the order, and you're like, I'm going to give this heparin. But if you're an experienced nurse, you're going to say, wait, hold up. Okay, I know that the heparin that I have in my hand is right. Okay, and but is it still safe to give? And that's really the question. I've always said you can hold medication, but once you give medicine, you can't take it back. Okay. So, with this series and like all the other series, my plan and my hope is always to teach you how to think like a nurse, to prevent, in this situation, life-threatening bleeding. Okay. So, hopefully, by the end of this lesson, we'll go over a heparin calculation. We'll do some, talk a little bit about laboratory monitoring. We'll do an infusion calculation, talk about bleeding, talk about nursing priorities, thinking through, looking at, clinical judgment and, how the NCLEX really wants you to, to think or reason when it comes to heparin and heparin calculations. Okay, so one of the biggest, well, I don't want to say biggest mistake, but a mistake that students make, is trying to, and I always say, don't really memorize, even though you have to know things, but you need to understand what you're doing. And that's what really nursing is all about. You can have an order, and like in this case, you can have a heparin order, but you have to understand what it does. And when you give it to your patient, what happens? So think of it like this. So normally, blood just flows through the vessels, like a highway. It's just, flowing. And then when your patient develops a clot, it's like a traffic jam. Blood can't move efficiently like it did before. And sometimes that clot can dislodge and go up to the lungs, it can go to the brain, it can even go to the heart, and that's where heparin comes in, you know. Um, and sometimes students tend to misunderstand. They're like, oh, I'm giving heparin because they think that it dissolves the blood clot, but it doesn't. Heparin does not dissolve blood clots. Let me say it again. Heparin does not dissolve blood clots. Heparin does not break apart an existing clot. Instead, heparin helps prevent the clot from getting larger while your body gradually breaks it down naturally. Okay. And this is a big concept, on the NCLEX. So heparin is an anticoagulant, okay? And anticoagulants like heparin are used to treat patients when they have venous or arterial disorders. Because these disorders are help will increase the risk of a clot being formed. So venous and arterial disorders increase the risk of clot formation. So when you're looking at venous problems, you're thinking of deep vein thrombosis, so DVT. You're thinking of PE, pulmonary embolism. When you're thinking of arterial problems, you're thinking of a coronary thrombosis, a myocardial infarction, so an MI. Um, Clot formation can happen with patients that have artificial heart valves, and CVA, so cerebrovascular accidents or stroke. Okay. Um, one main thing with heparin is that it helps prevent blood clots by working with antithromboin 3. Yeah, what it does is it speeds up the process that stops the formation of clots. And by blocking the conversion of fibrinogen into fibrin. And so heparin helps stop a clot from forming. So remember, it helps a clot from forming. It does not dissolve a blood clot. It does not break up an existing blood clot. But what heparin does is it helps stop the formation of a clot. And remember, clots, they use proteins and they use platelets, which lower the clotting factors and which leads to more bleeding. Okay. So, we want to definitely use, heparin to prevent clots from forming. So let's look at a patient. So you have a patient, Mr. Rodriguez, 58-year-old male. He's diagnosed with community-acquired pneumonia. His last visit, he had type 2 diabetes, and today he's coming in with um, right calf pain, warmth, swelling. The provider goes in and sees him. They will do an ultrasound. And during that ultrasound, they found a DVT, so a deep vein thrombosis. And so provider writes some orders, and his orders are he wants the patient to have a heparin bolus, 5,000 units IV, and then begin heparin infusion. Now remember, heparin is given subcutaneous for prophylaxis. Okay, typically you may see that after surgery. Um, um, but you'll see patients receive heparin IV, so intravenously, to treat acute thrombosis. It can also, be given as an IV bolus or as an IV infusion. So before we kind of look at a calculation, try to remember these things. A lot of times, we tell students you have to always ask a question before doing anything. So with medications, and you'll see this over and over again, the first thing is what was ordered? What do I have available? Okay, what does the hospital have available? Then you're looking at, okay, what am I solving for? What is the question asking for? And then do the units match? Because if the units do not match, then you're going to have to set up some kind of dimensional analysis to solve the problem. And then once you solve it, and once you realize, okay, what's being asked in the question is what I actually have in my calculation, does it make sense? And if so, is it safe to give? And that's a big thing. You can always solve a question correctly, but is it safe to give right now? So let's start. All right, like we said, the provider orders 5,000 units IV. And what you have in the hospital available is 10,000 units per milliliter. Okay. And so how many milliliters would you give? So, when you're thinking of the roadmap, what was ordered? What was ordered was 5,000 units. And then what is available to you? The 10,000 units in 1 milliliter. And so you want to figure out how much to give, and we're giving it IV, as an IV bolus, an IV push. So you're looking for milliliters, right? And so you're like, okay, well, do the units match? Well, yes, right? Because you're trying to figure out, how many milliliters to give. So when you're setting up your dimensional analysis, you're going to take the 5,000 units, which was what was ordered, and then divided by the 10,000 units, which is what is available. And then 10,000 units is in 1 milliliter. So when you calculate this out, the units will cross out, and then you would divide the 5,000 by the 10,000, which would give you 0.5 milliliters. Okay. Now, before you give it, you always should assess your patient assess your patient before, and then after. I said before twice, and after. So Now that you've calculated everything and you're about to give it, you have to think of, okay, what assessments would concern you of this patient for giving the heparin? What laboratory values do I have to review before giving the heparin? Um, can I administer it now? Like I said, you can always hold the medicine, but if you give it, you can't take it back. And so if it's yes, I'm gonna hold it, or yes, I'm gonna give it, why or why not? And so here this goes along with the assessment piece. When I said before, I had to think about it. So you want to assess your patient before you even go get the medicine to calculate it, right? And then you want to assess your patient before you actually administer it. So that's where the before the four came in. And this is one of the things that you would do during one of those befores. This is where your clinical judgment kicks in. Have you really assessed your patient? Do they have any bleeding, any history, any recent complaints, any unusual bleeding? Did they complain of hematuria? Did they complain of bleeding gums? Okay. Um, what's their platelet count? Heparin can decrease the platelet count, causing thrombocytopenia. So have you assessed their platelet count? The PTT, if the patient's already on therapy. Have you looked at a baseline PTT? Have you looked at other labs like a liver function panel? Because the liver can affect clotting. Has a patient recently had surgery? Because if they have, you're also going to look at is the patient oozing at the surgical site, right? Any history of GI bleeding? Did the patient ever have a peptic ulcer of any kind? Then you're like, okay, well, peptic ulcer, you're going to look at um, rectal bleeding. There's so many things that can go on. Have you noticed? Has the patient complained of anything? Have you done a thorough physical assessment? Have you checked either any bleeding in the mouth or gums, like we said a little while ago? Nose bleeding, epistaxis, urine, hematuria. Have they complained of it? Have you looked at the skin? Do you notice any petechiae? Anything that would indicate that your patient is bleeding. You want to make sure that you assess this before giving the patient more heparin. Okay, so understanding PTT. Okay, what is it? So think of PTT as the amount of time it takes for blood to clot. It looks at deficiencies of the clotting factors, of certain clotting factors. And, it's used to assess heparin therapy. I tell my students, when you thinking of, oh my goodness, which goes with, what goes with heparin? And I say, okay, with PTT, think of the two T's, kind of like an H, and you'll know that that particular laboratory value goes with your heparin. So, you know, um, thinking of heparin, you know, okay, well, let me say it like this. Normal blood clots very quickly, okay? And heparin intentionally slows that process. When we give our patients heparin, we are slowing the body's ability to clot. But if we slow it too much, the patient can bleed and they can bleed out. So there are therapeutic ranges and targets, which will vary by hospital. So when you are in nursing school, they may use a certain book and you will study and read and learn the range for your testing purposes based on the book that you're using. Once you move on and you're working in a hospital setting, you're going to go by the hospital's rules and what their protocols are when it comes to heparin therapy. And then looking at the provider's orders. The provider may say they want, their PTT between a certain range. So that's really what you're basing it on. But you really want to know those ranges prior to and then while you are administering heparin. Okay, so let's look at an infusion question just quickly. All right, so you have an order. Your order is 1,200 units an hour. Okay. And then you're looking at what do I have? All righty. You have 25,000 units in a 250 milliliter bag. Okay. So what's ordered? 1,200 units an hour. What's available? 25,000 units and 250 milliliters. Okay. So do they match? No, it doesn't match because you need to solve for milliliters an hour. So let's walk through this. All right. So you are going to first figure out how many units are in a milliliter. So we know that we have 25,000 units in a 250 milliliter bag of fluid. And when you divide the 2,500 by the 250, you will have 100 units per milliliter. Okay. So you have the 100 units per milliliter, but that's not what you're solving for. You're solving for milliliters an hour. So then you look and you say, okay, what I have ordered is 1,200 units an hour. So then you take the 1,200 units per milliliter and you divide it by what you have. You have 100 units an hour. And when you cross out the units, you will have milliliters an hour. And that's what you're looking for. So you're looking for, and this kind of goes back, if you're looking at the series, what was ordered, 1,200 units an hour, by what is available to you. And you have a solution that gives you 100 units per milliliter. And when you cross out the units and then divide the 1,200 by 100, you will have 12 milliliters an hour. And that is what we were solving. So now the units match for what you were solving for, right? But then you always have to ask your question. You ask the question to yourself, okay, my calculation is right. And is it safe to give right now? Now remember, Mr. Rodriguez, what did he say? He said, when I was brushing my teeth this morning, my gums started to bleed. Now, yes, the doctor ordered it. Yes, you calculated right. We know it's um, uh, 12 milliliters an hour, and you set up your thing and you think about it. Oh my goodness. What assessment concerns me? Well, the bleeding gums. He didn't have it before, and no one documented it in the charting, right? What laboratory do I look at? You're going to have to go and look at his PTT if they even have a baseline, right? Because if you're the first person that's going to start this infusion, they may not even have one, but you're going to check to see if they have a PTT ordered. Are you going to administer it right now? Well, his gums are bleeding. You know, more than likely you won't, because if it wasn't bleeding before, now you have to do an assessment. You're going to assess his urine. Can you look or you ask the patient for any signs of hematuria? Was there bleeding in the stool? You know the gums. Do you see any bruising on your assessment? Check his mental status. Has his mental status changed? Blood pressure, heart rate. Has he had any recent falls? You know, you want to make sure that you are safely administering this medication to the patient at the right time. The pump can wait. If your assessment shows that it is not the right time to give the medicine, you document it, you document why, and you notify the provider. So that's kind of put this in a unfolding kind of case. Okay, so on your assessment now, you didn't hang anything up. So on your assessment, you were about to hang some stuff up, but you notice, oh my goodness, you always take vital signs. His blood pressure is 90/56, heart rate 118. Um, you notice on your assessment, he has this large bruise, bleeding gums, he's dizzy. You check the labs, and his hemoglobin has decreased. Okay, think about that. What actually concerns you? Think about, man, what could be going wrong with this patient? Does he have too many anticoagulants? Is he over Is it that he's the anticoagulation, is it too much? Um, does he have the internal bleeding? I mean, that blood pressure is kind of low and that heart rate's kind of high. I mean, is this a complication of the heparin? What could be happening? You're thinking of all these different hypotheses. Bleeding due to the heparin, hypovolemia. That would explain the low blood pressure and the high heart rate. And man, do I need to do something right now? What am I going to do right now to protect my patient? And so you may have to hold the infusion if you start it. Okay. You're definitely going to notify the provider. You're going to give them your vital signs, the assessment. You're going to tell them the laboratory results if they have any. You're going to constantly monitor your patient. You're going to anticipate or prepare for an antidote to be given if the provider orders it. Um, you're going to uh, like I said, you're going to stop the infusion. And then once you do all of these things, if they order, okay, prepare for an antidote, or they say, okay, stop the infusion, or whatever orders they give you, when you go back and you evaluate your interventions, did the bleeding improve? Did it stop? Did the blood pressure stabilize? Remember, it was 90 over 56, I think. So did that stabilize? Is the patient alert? Did they stay alert? Okay. And this is why every time you do an intervention, you have to evaluate for an outcome. So, what if the doctor ordered an antidote? What is the antidote for heparin? And it is called protamine sulfate. So, protamine sulfate is used to reverse the effects of heparin during an overdose or when heparin reversal is needed. But try to remember that giving protamine sulfate can also lead to serious drops in the blood pressure, and some people may have serious allergic reactions. So you want to make sure that you monitor for those too when giving protamine sulfate. So when you're looking at heparin, you know, common student mistakes are they confuse the units with milliliters, or they don't make the right conversions. If you notice on our infusion problem, there was actually two steps to that problem. And so they didn't work the problem all the way through. They forgot to monitor for signs of bleeding. They didn't do a proper assessment. They didn't even look at the lab values. Uh, they only looked at, I saw an order, the order was for heparin. I want to make sure I calculate correctly, and then I give. They only focused on the calculations and administering the medicine. They didn't even think of, oh, let me assess to make sure, is this the right medicine right now for this patient? They miss the signs, the subtle signs of internal bleeding. They miss the gums, the bleeding gums. They miss the slight pink tinge to note that the patient has hematuria, the slight pink tinge in the urine. They didn't really do a good assessment of the skin. They missed the petechiae. They missed the bruising, you know. And they just, I don't know, students sometimes they just didn't think of, do I question, is it okay to give this medicine right now? So for heparin, we did a bolus. Remember we did the calculation where we came up with 0.5 milliliters to give your patient. We did infusion calculation. We talked about PTT and looking for bleeding. How you can use clinical judgment when it comes to giving heparin to your patient. Um, Talked about the antidote, protamine sulfate, and what can you do to keep your patient safe when you're giving heparin. One thing that I did not talk about, and I'll mention right here, is falls. You really want to make sure that when your patient is on heparin, that you definitely reduce the risk of falls. If a person has a fall and they hit their head, then they can possibly have you know um, cerebral bleeding, and which will cause a mental status change. So you really want to make sure that you protect your patient and it always at all times. And I just want to, mention a few things when it comes to heparin. And we talked about it before. Just because you correctly calculate something, That's really only the beginning of safe administration. You really have to ask yourself questions. Is this the right time to give this medicine? Remember that heparin does not dissolve clots. It prevents them from getting larger while the body does its own thing with kind of dissolving or healing itself. Never never worry more about the pump than assessing your patient. Okay, your patient always comes first. Always remember that, the first sign of bleeding may not be this, oh my goodness, they're just gushing blood. Very subtle signs. Like we talked about, a small change. Like we said, bleeding of the gums, hematuria, bleeding in the urine, a new bruise. All of that could be sudden, subtle signs of bleeding. So you really want to make sure that you properly assess your patient to prevent, life-threatening complications due to heparin administration. And that's it. Um, we learned a little bit about heparin today. We went over, two basic heparin calculations. If you want some more of those, I would be happy. Just please leave a message in the comments. Um, hopefully you learned how to protect your patient from like, this dangerous medication complications that, we as nurses will encounter. You want to always, when one, you want to make sure, okay, is my calculation correct? That is number one. Does it make sense, right? And is it safe to give right now? If you kind of ask yourself these questions every time you do a calculation or any kind of intervention, to be honest with you, I mean, not saying the calculations is correct, but when you do other interventions, is this intervention right to give right now? Is it right? Does it make sense to do this right now? Does it make sense? Is it safe to do an intervention? So this actually, would be good at any time. So you really want to make sure that you always ask questions. There's nothing wrong with doing that. And that actually helps with the NCLEX. It'll show that, you are developing habits of thinking like a nurse. And that's a great thing. So, remember, when it comes to dosage calculations, it's not just math, it's really patient safety. Um, in this series, my goal is to help you understand not only how to calculate, but how to think, um, like a nurse would before you give or you administer a medication. So in the next video, we are going to go to episode 8 um, of the Stop Fearing Dosage Calculation series. I am going to go over IV flow rates. I'm going to at least give uh, three calculations for that one. Um, to hopefully make it easier. That's my goal is to try to make things easier. But if you find that you want more calculations, like I said a little bit ago, just let me know. And I'll put something together with just calculations. Okay. So thank you so much for watching and happy studying from NurseEdScholar.